Well, Singapore says cruises to nowhere will continue after yesterday's suspected COVID-19 case on board the Quantum of the Seas. The tourism board says the handling of the case was swift and robust. The cruises are part of a pilot to safely kickstart the tourism industry. The Royal Caribbean ship had to turn back a day ahead of schedule. An 83-year-old Singaporean had tested positive for the coronavirus. But the Health Ministry has confirmed that the man does not have COVID-19 after testing negative 3 times.
Singapore's Trade and Industry Minister says the COVID scare has allowed the cruise industry to test the entire system of robust safety protocols. Chun Sing has also stressed the need for rigorous testing and tracking processes even after vaccines are available.
There will always be a slight chance that there is a false positive, and that varies across different tests. Likewise, there's also could be a false negative, right? That is inherent within any test. The second thing is that because of that, that's why we need a series of protocols to make sure that we minimize the risk to the lowest possible.
Well, experts say several factors could affect the accuracy of a COVID-19 test. These can include how the test kits are stored and the quality of the kits themselves. Now, they say it's also crucial that those conducting the tests are properly trained. And that's because timing is key. Variations during swabbing or actual testing of the sample can lead to inaccurate results. The affected Royal Caribbean ship has a medical facility on board with a PCR testing laboratory. There's been no response as yet to CNA's query on which type of kit was used to test the 83-year-old passenger.
You need to remember that this is, if you like, a makeshift laboratory on a cruise ship. It's not practiced, it's not tuned to this high level of technical expertise. For those of us that work in this field, we often see false positives and false negatives, and that's in a perfect world. So this is the very nature of tests. It's not very many tests where you can get a 100% answer every time.
Say that for COVID tests in general, within this year, there still had not been enough time to really perfect all the test parameters. For example, the pregnancy test is HIV test. These are perfected over many, many years, very large scale clinical trials, and sometimes the antigens and the antibodies involved are even very specially genetically engineered to be that good.